Curcumin is the most active compound in turmeric. It has gained tons of attention for its powerful anti-inflammatory and antioxidant properties. But if you don't know how to use it properly, you might not get the full benefits. That's why in today's video, we'll dive deep into the do's and don'ts when it comes to taking curcumin so you can make the most out of it, as well as show you a form of curcumin that is far more superior when it comes to absorption. And no, it's not with black pepper. So stay with me till the end. Also, real quick before we get started, it would mean the world to me if you hit the like button down below to help push this video out there and turn the bell on to stay up to date with new weekly videos. Now, we've already discussed curcumin and turmeric in other videos that we go in depth with. So if you want to learn more about it, you should check out those videos I left below for you as well in the description. But let's get to the first do, which is knowing that curcumin on its own is often poorly absorbed and can pass through your gut undigested. A helpful tip that you may have heard is to add some black pepper to your meals or supplements that contain curcumin. This may explain why a lot of your favorite dishes that include turmeric also contain black pepper at the same time. Now, a lot of supplements have included piperine, which is the famous alkaloid in black pepper, into the formulation in order to boost its absorption. And there are currently two theories on as to why this works. First, piperine makes it easier for curcumin to pass through the intestinal wall and into your bloodstream. And secondly, it may slow down the breakdown of curcumin by the liver, increasing its levels in the body. So let's say if you're cooking with turmeric or taking curcumin supplements, make sure to add a pinch of black pepper to the mix. And like I said, many curcumin supplements already include piperine, so check the label to ensure it's included. The dose of the piperine should be anywhere from 5 to 10 milligrams standardized to 95% piperine for the best results. Any more may lead to heartburn for some folks, so keep that in mind. But if you wanted even a superior way to increase its effects versus the black pepper, and actually 29 times greater absorption versus curcumin alone, Curcumin Phytosome would be a better fit. Curcumin Phytosome contains a phospholipid group attached to the curcumin molecule, which helps it to stay in your system for a longer time. Thorne Research has formulated one, and I've left it below for you down below as an affiliate should you wish to check it out. It helps the curcumin you just ingested to get to the right areas throughout the body. And is the most clinically researched curcumin out there. Not to forget they have an NSF version. And NSF is considered to be one of the most respected and reliable third-party testing organizations for supplement brands. They consistently pass a third-party certification with NSF, which is not just a one-time inspection like other companies. They pass regular retesting and on-site inspections to ensure that the products continue to meet standards, because not all supplement manufacturers are the same, guys. Actually, in the past years, 13 brands of turmeric were removed because of lead contamination. So be cautious when buying supplements online and make sure you're getting a good and clean product. And no, that doesn't mean that you have to go with Thorne's version. What's more important is you do your own research and get a clean supplement. Now for the don't. Don't expect instant results. Unlike over-the-counter painkillers or medications that work quickly, curcumin operates differently. Let me explain why it takes a little longer. It's because curcumin works by gradually reducing inflammation at the cellular level. Think of it as a long-term investment. While you won't experience immediate relief right away, with consistent use, you'll notice improvements over time. And for what conditions, you might ask? Well, if you're dealing with chronic conditions like arthritis, joint pain, inflammatory bowel disease, or even skin conditions like eczema and allergic rhinitis, curcumin may help. You're going to have to give it 4 to 6 weeks to start showing visible improvements, and this is depending on the severity of the condition too, so it might even take 2 to 3 months before you notice a significant difference with curcumin. And keep in mind that this timeline, guys, also depends on other factors such as your diet and lifestyle. Is your lifestyle getting in the way of your curcumin from taking effect? Examples are poor quality sleep, stress, excessive alcohol intake, and other behaviors that make inflammation worse. And as a side note, I wanted to actually talk about a really fascinating use case for curcumin, which is how curcumin increases BDNF, otherwise known as brain-derived neurotrophic factor, and why this isn't important as we age. Well, BDNF helps protect your brain cells from damage, especially when the brain is faced with a challenging situation. Super important, right? Well, also BDNF is important for forming and storing memories and can help with long-term memory as we age. We actually have 4 randomized control trials with 139 participants that showed in just 8 to 12 weeks, remember that results don't come right away, For BDNF, it's 8 to 12 weeks. The curcumin supplementation dose and duration range from 200 to 1820 milligrams daily, significantly increased serum BDNF levels. So remember, just because it's been a month and no changes have occurred doesn't mean you throw the bottle out. Now for the next do take curcumin with a fat source. Curcumin is fat soluble, meaning it dissolves in fats rather than water. For your body to properly absorb it, curcumin needs to bind to the fats, because without it, much of the curcumin you consume may go to waste. Now, the Curcumin Phytosome does a better job in keeping it stored in the body for longer, but study shows that taking it with about 15 grams of fat, and for reference, one avocado contains about 20 to 30 grams of fat, can help absorption even better. The next don't I would include is don't go overboard with it. While it's generally considered safe, taking too much curcumin can lead to some unpleasant side effects like nausea, diarrhea, or digestive issues, which begs the question, what is the best dose of curcumin then? Research suggests that 500 to 1,000 milligrams of curcumin per day is the optimal range for most people. You don't want to go over that unless advised by your healthcare provider. Lastly, the last do remember that curcumin is for chronic conditions, not acute ones. Curcumin shines when it's taken long-term for chronic inflammation and joint pain, for example. It won't provide immediate relief for conditions like a headache or sudden muscle strain, which is why it's always best to ask your healthcare provider if you are a good candidate for curcumin. Because, for example, and this is just one, if you're severely low in iron in the context of subclinical iron deficiency, curcumin is found to bind to iron, which may be helpful for people with conditions causing excess iron buildup in the body. However, when people need more iron, the curcumin may bind to it and make it unavailable for the body to use. But guys, I'm more curious to hear from you. What are your thoughts about curcumin? Leave them in the comments below, and until then guys, I'll see you on the next one.